question was about the involvement of young people in this process, and you're right. I mean, young people have not been as involved in this process as they have been on other issues. It's not, I think, an issue which in some ways naturally concerns young people. Young people are healthy, they don't have a lot of health needs generally. It's not as sexy as the environment or education or issues like that. But you know, and we really have been working and trying to reach out to young people to make sure that they understand that this is an issue which, if it doesn't affect them now, will affect them in the long term. It's an issue that's important because we spend twice as much as any other industrial country on healthcare. 16% of GDP, probably be 22% of GDP in a few years if nothing's done. By contrast, Germany spends 12%, France about 8%, Britain about 7%. This is an issue which has impacts more than any other our financial stability. If we don't get healthcare costs under control, somebody's going to have to pay for it. We're going to have an increasing number of people, your parents, my parents retiring. We're going to, if we don't figure out a way to get these costs under control, you know, we're going to have less money to spend on education and on clean energy and on all the other things that matter because we're going to be spending so much on healthcare. And this is the time to do something. And so it really is an issue that will, if it may not impact you today, but it will certainly impact you personally in the coming years, and it will impact all of us in a decade or two once we have all these seniors retiring.